Spironolactone for heart failure with preserved ejection fraction. Introduction. Mineralocorticoid receptor antagonists improve the prognosis for patients with heart failure and a reduced left ventricular ejection fraction.
On models, the superior and inferior vena cava will be painted blue because they carry deoxygenated blood. They both empty into the right atrium.
Introduction. We evaluated the effects of spironolactone in patients with heart failure and observed a left ventricular ejection fraction. Methods. It is randomized double-blind trial. We examined 45 patients with symptomatic heart failure and a left ventricular ejection fraction of 45% of more to receive either spironolactone 15 to 45 mg daily or placebo.
The AV valves, or atrioventricular valves, have an atrium above them and a ventricle beneath them. This valve is the right AV valve because this is the right atrium and this is the right ventricle. So this then is the right AV valve. It has chordae tendineae attaching to the cusp.
Methods. The primary outcome was composed of death from cardiovascular causes, aborted cardiac arrest, or hospitalization of the management of heart failure.
Idiopathic thrombocytopenic purpura is also known as ITP, a much easier term to spread. It's also known as immune thrombocytopenia. Idiopathic thrombocytopenic purpura is also known as ITP, a much easier term to express. It's also known as immune thrombocytopenic purpura. So ITP is classified as an autoimmune disease with symptoms of low platelet counts, bruising, petechia, which is microbleeding in the skin, and also poor coagulation function and overall
Results. With a mean follow of 3.3 years, the primary outcome occurred in 320 of 1,722 patients in the spironolactone group. Results. Of the components of the primary outcome, only hospitalization from heart failure had a significantly lower incidence in the spironolactone group than in the placebo group. Results. Treatment with spironolactone was associated with increased serum creatine levels and a double of the rate of hyperkalemia, but reduced hypokalemia. Results. With frequent monitoring, there were no significant difference in the incidence of serious adverse events. A serum creatinine level of 3 milligrams per deciliter of height of dialysis. In patients with heart failure and a perceived ejection fraction, treatment with spironolactone did not significantly reduce the incidence of the primary composite outcome of death from cardiovascular causes.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from
First Aid for the USMLE Step 1, 2013 edition.
Page 559. What is superior vena cava syndrome? Superior vena cava syndrome is
Aborted cardiac arrest or hospitalization from the management of heart failure. Thank you.